Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera. Good morning to all the new intakes into the postgraduate program of UKM. I've been asked to talk about medical ethics as introduction to this program. Now, the reason why I chose the word introduction to ethics in clinical medicine is in the 40 years that I've been involved in medical inquiries and to complain against doctors, I've noticed that there were many instances when there was actually a lack of understanding of medical ethics, as well as maybe people have forgotten about medical ethics, and also not adhering to the code of professional conduct is found in the Code of Professional Conduct of the Medical Council that's distributed to all doctors when they register with the Medical Council. How do I do this? Let me begin to, very quickly to medical ethics from the historical perspective of professionalism in medicine. The present medical ethics is based actually on the code of the ethical conduct of the ancient code of Hippocrates. This was formulated by Hippocrates a few thousand years ago in the island of Kos in Greek, and it's no longer used. Now we have our modern international code of ethics, and also recently there is an introduction of the Islamic code of medical ethics. Now we have to be very clear between the word etiquette and ethics. Now etiquette is, I think it's French from origin, and is actually, etiquette means a code of polite behavior or conduct in any society or among members of a particular profession. So in bahasa, to be very clear, perilaku yang beradab serta bersopan santun di kalangan sekumpulan manusia di dalam satu badan atau profession. So so etiquette is quite different from ethics. It doesn't mean that the medical professionals need not have any etiquette in their practice. Ethics is concerned with the moral principles that govern a person's behavior or the conduct of an activity. It comes from the Greek word ethikos, means the science of moral. Now, with regard to medical ethics and etiquette, as doctors, we will all have to abide by the code of professional conduct of the medical practitioners. This can vary from country to country, but we have our own code of professional conduct, which Professor Zaliha would be talking about later. Now, as far as a doctor is concerned, the etiquette to be shown is that he must behave and look like a doctor. Neat, clean and tidy, dressed appropriately when dealing with patients, when in the hospital, any health setting. It should be someone who soft-spoken, kind, considerate, and not arrogant. And he must be a good listener. Respect for all patients, irrespective of gender, race, color, status, and sexual orientation. This is very important these days. And for Muslims, I think it's appropriate, to greet patients, and Muslim patients, with Assalamu alaikum, and begin the examination of the patient with Bismillah. That would be much appreciated. So, what is medical ethics then? Medical ethics is a civil code of behavior considered correct by members of the profession for the good of both the profession and the patient. So that's in short about what is defined as medical ethics. And as I said, the original code is formulated by Hippocrates. uh, and the oath is taken by all graduating practitioners, the purpose of which at that time is to protect patients and practitioners. However, we no longer use them in the original version because in the original version, the names of the various gods of the old religions are mentioned. So it's no longer used in that form now. Now, in September 1948, the Second World General Assembly of World Medical Association in Geneva adopted the International Code of Medical Ethics, which is being used right now, but has been what called amended by the 32nd World Assemblies in Australia in 1968, and at the 35th World Medical Assembly in Venice in Italy in October 1983. That's the International Code of Medical Ethics that's being adopted by the Malaysian Medical Council. So if you read this, the book that's been given to all doctors who have registered in Medical Council, okay, it's clearly stated the members of the medical profession are expected to abide by a code of ethics established by the profession itself. The purpose of the code is to safeguard the public, ensure propriety in professional practice, and to prevent abuse of the professional privileges. Now, this code, International Code of Medical Ethics, was adopted, and then the Medical Council adopted it on the 9th of December in 1986, and I was actually present when it was adopted. Now we go through the Declaration at Geneva, which outlines a general principle of medical ethics. Is you solemnly pledge to consecrate your life to the service of humanity, and that's a very big declaration. And importantly, I will give to my teachers the respect and gratitude which is their due, and I will practice my profession with conscience and dignity. The next is the health of my patient will be my first consideration. I will respect the secrets which are confided in me even after the patient has died, and this is very important, remember that. I will maintain by all means in my power the honor and the noble traditions of the medical profession, and my colleagues will be my brothers, which means also sisters, right? Just that the word brothers means almost genderless. And this is another important aspect of the Declaration of Geneva. I will not permit consideration of religion, nationality, race, party politics, or social standing to intervene between my duty and my patient. I will maintain the utmost respect for human life from its beginning, even under threat. And I will not use my medical knowledge contrary to the laws of humanity. And you make this pledge, I make these promises solemnly, freely, and upon my honor. So the traditional emphasis up to the 1960s is related to doctors' duties to the patients, which we call the Hippocratic tradition. Firstly, it's called non-maleficence. It is a French word. Do no harm. Whatever you do to your patient, do no harm. And if you have to do anything, you must do good, must benefit the patient. So the word beneficence. And thirdly, it's very important to place your respect for teachers and your colleagues. Not only you must respect your teachers, your own colleagues. You've got to respect your own colleagues. And importantly, you have to respect your patient and their family, and respect for life. And the important thing that is not to be forgotten is confidentiality and an honorable personal behavior. So these are, you know, the 7 points that you have to remember about in relation to the duties of the patients, of the doctor to the patients. But more recently, the contemporary bioethical principle in medicine make it simpler to just 4. Beneficence, non-beneficence, do no harm, autonomy, and justice. Now, autonomy is a very important aspect because now patients will have to make decisions for themselves. And they can have a choice whether to undertake certain treatment or not, and not agreeing to you to do certain treatment. They would like to have choices in the treatment, and they would make their decision for themselves. So that is why of the importance of the informed consent nowadays, because we have to ensure that when a patient makes a decision to be treated by you, to undergo certain procedures, it is their own free will and with full understanding of the problems, the possible complications, and the possible outcomes. And fourthly is justice. Well, justice means justice for the patient. And also, but remember that justice not only meant for your single patient, but it means to the community. There is such a thing as also distributive justice. These are meant for people who are in an administrative situation when they agree, say, to introduce a particular treatment. It must ensure that in terms of distribution of a fund, there will be justice so that you do not put all your fund into a particular form of a type of treatment, or and then you draw up all the money into that particular treatment, and you have very little money for the other simple treatment. And this also meant for people, say, in the ministry, when you what we call distribute your fund, the money, ensuring that there's equal distribution as well as directing it into the priority areas where money is required. Now, I would like to introduce to you some aspect of medical ethics from the Islamic perspective. And I come from University of Islam, Malaysia. We have also to look into the Islamic perspective of medical ethics. Now, despite the fact that medicine among the early physicians of Islam are very advanced, and they, unlike Hippocrates, there were no written or codified code of ethics in the history of Islamic medicine or literature. It's because those physicians at that time, were very well versed in the Quran and Hadith. So, and it is thought that it's not quite necessary because all those values are already present in the Quran and Hadith. But not every Muslim and not many, I would say, many Muslims are well versed in the Quran and Hadith. So it was thought that it's about time that Muslim physicians draw up kind of a code of medical ethics, and they did it in 1977 by Islamic Medical Association in 1977, and then they improved on it in 1981. There's a quick document of Islamic Code of Medical Ethics, which was formulated in the International Organization of Medicine in 1981. So there is also some other code of medical ethics, but basically the code of ethics is simply that in this regard, I would like to say that graduate from our medical school and passing the examination before they register themselves with the medical council. They are made to take this oath in front of the teachers. So is I swear by God, with Allah the Great, regard God in carrying out my profession, to protect human life in all stages and under all circumstances, doing my oath to rescue it from death, malady, pain, and anxiety, and to keep people's dignity, cover their privacies, and lock up their secrets. So the Islamic Code of Medical Ethics is basically, to say that you are an instrument of God's mercy. You extend your care to virtuous sinners, friend, enemy, near and far, yeah? And to strive in the pursuit of knowledge and harnessing it for the benefit, but not for the harm of mankind. And it's also stated here, the same as with the International Code of Medical Ethics, to revere my teacher, teach my junior, and be brother to members of the medical profession, join in piety and charity. Right? And this is the important aspect of the personal behavior of doctors, is to live my faith in private and in public, and avoid whatever blemishes me, I and in the eyes of God, His apostle, and my fellow faithful, and may God be witness of His oath. So this is a very powerful oath, because in Islam, we all believe that whatever you do, Allah will know and will see, will be all-knowing. So basically, whether you're dealing with the International Code of Medical Ethics or the Islamic Code of Medical Ethics, it means that you take an oath to perform your duty selflessly with honor and dignity. That word is very important, honor and dignity. We belong to an honorable profession, and we should move around with dignity. We should respect for life at all stages, meaning that abortion is forbidden, but under circumstances is allowed, both in the in the Islamic Code of Ethics. And the other thing is the same: respect for teachers, colleagues, and buyers, and patients' welfare must be uppermost, and maintain confidentiality. So these are the fundamental principles of medical ethics, right? So with that, I would like to end this very short introduction to medical ethics. I hope you have been enlightened with regards to the various code of ethics. And this code of ethics, as I said, is translated into our Malaysian Code of Professional Conduct. And I would like you all to be very familiar with the Code of Professional Conduct, and for which I think Professor Zaliha will highlight further with regards to some of the issues of non-compliance with the Code of Professional Conduct. And also, we must also ensure that you're very much aware about some of your medical legal responsibilities, because in case of medical negligence, not only can you be subjected to disciplinary inquiry by the medical council, but you also can be taken to court and be sued in the civil court. And also, don't forget that we are also subject to the other laws of the countries, the criminal laws. And in fact, with the recent development in the UK, doctors are grossly negligent, have even been charged with manslaughter. So as doctors, you must be very familiar with the medical ethics and the good professional conduct, and be aware of the various things that can happen if there is negligence in a professional sense, which I think there's Dr. Hassan, I think, will be talking about after Professor Zaliha. With that, thank you very much.
Thank you so much, Dato. I think you have enlightened not only the younger doctors, yeah, but certainly all the rest of us too, Dato, because I think medicine is a lifelong journey experience, right? There's lifelong learning. So I think it's always very timely that we are reminded about our duties, right? Sometimes we become so immersed that we may even forget or you know, worse, ignorant. So I'd like to invite our participants, our students, to please type in if you have any questions under the Q&A section. But there is already a question here, Dato. It's from a colleague, Professor Dayang. She says, Salam, Dato. Okay. In your 40 years of experience in medical inquiry, which is the most common cases or issues brought forward to the council?
The common issue actually is in relation to one is overcharging. Secondly, doing procedures it's not supposed to be done, and the other one is when gross neglect of professional responsibility amounting to negligence. And of course, you know, you must remember as doctors, you have to ensure that you behave properly, even outside the hospitals. Your personal behavior is very important, because any conviction in a court of law for anything that may construed as a behavior not in keeping with the professional person's, it is something that, you know, can be charged in the medical council. So, of course, there is also issue of breach of confidentiality and also improper relationship with patients. That's so many. I can go, but you can just go through to the code professional conduct. Almost everything that's inside there that come to us for inquiry.
Thank you, Dato. There is another question here. Dr. Asha has asked, morning, Dato.
Morning.
At times of emergency, no next of kin available, we proceed with life-saving procedures. Maybe a comment here, Dato?
Oh yeah, okay. Important thing is to save life. So if what is the priority is to save life, and you just do that without a second thought. Once you have resuscitated the patient, it depends on whether the patient needs an urgent surgery or surgery that can be delayed. If the surgery has got to be immediately done to save a life, then we can go ahead and proceed with the surgery, having another person, you know, picking up signing up the consent, because this is a matter of a life-saving situation. But as far as consent is concerned, the usual informed consent is only in situation where the patient is conscious and of sound mind and is able to make decisions on himself. But otherwise, in an emergency situation, you just do what is necessary to save the patient's life.
Thank you, Dato. There is another question. What do you think, Dato, with the anti-vaxxers, which are getting increased in number nowadays? They are not even anti-vaxxer, but also refuse almost all intervention which can be life-threatening. This question is in regard to the autonomy aspect in bioethical of principal medicine. Thank you.
Or there is even autonomy, there is a limit. If you are, if you are become a danger to the public, and there is a public has got the right to protect itself, isn't it? So with regards to these people who refuse to give vaccination to their children, find under the present law there is no compulsion. You cannot take any legal action against them. But if doctors who refuse to give vaccination, then I think that would be quite unethical under our present ethical code, because you're endangering the life of another person.
So I think Dato has stressed a very important point. Even autonomy has its limits, right? Because you're talking about, first and foremost, we are here to save lives, isn't it, right? And it's a responsibility, okay? Dato, maybe one more question. When we talk about professionalism here, we talk a lot about performing our duties with honor and dignity, as Dato has mentioned, right? How do you learn to do this? Because one would have thought that it is something to do with your own personal character, and one would assume that if you are of good character, then you would presumably be doing it with integrity and dignity. So how do you do it? I mean, can somebody learn this to be good, or is something that dates way back, even before you enter medical school days, maybe even when you are a school student? I mean, it goes way back. What are your thoughts about that, Dato?
Behavior is all about upbringing. It starts from home and school. And of course, when you enter the medical profession, you also have got to emulate the teachers. If the teachers behave badly, I think the trainees will also behave very badly. It's how the teachers behave in the ward when conducting his work in the ward. And he has to demonstrate all these values. And if there is any infringement of all this, I think the person must be told, of course, in the right manner, politely, that we have to abide by certain code of ethics, as well as to have the etiquette of being a doctor. And it is something not acceptable that's in the case that quite a doctor who is on duty that day has gone to the pub and came to the hospital with the mouth smelling of alcohol, and then the patients complain that this doctor, even though he didn't appear to be drunk, but he smells of alcohol. That is totally unexpected. And if this particular doctor goes to the bar and involves in the brawl, I think that's totally unacceptable. So, but the more important thing is how the doctor behaves depends on how the teachers behave, and how the teachers are treating the trainers, the other staff, and how the patient, how the teachers take care of the patients they're treating. Basically, it's learning by example, actually, or leadership by example. So if your trainees behave, badly, I think should look who the teacher is.
Okay, thank you, Dato. Because I thank you for mentioning that, because I think you not only lead by example, learning by example. Okay, so I probably sum up a few things that Dato has mentioned. I think thank you for sharing the Islamic code with regards to medical ethics. I found that very interesting. And I think when you talk about justice, we always hear about the principles, right? Justice. But I think we always tend to think about the patient. But Dato rightly mentioned here is the community, right? So I think we have to be mindful about that. And when we talk about the 7 points that Dato highlighted about respect, it's not only to the patients and the family, but to the colleagues. So I think we really need to be mindful of that too. So I think with that, I thank Dato on behalf of the organizing committee, on behalf of the faculty. I certainly found that very, very enlightening, and perhaps I think there surely must be another platform to deliberate on all these matters again. So Dato, thank you so much for being with us this morning.
It's a
So
pleasure.
yeah, thank you so much. Okay.